Well, good morning, everybody. It's AKA Heather Joy here, and you are on the lifeboat. Welcome, everybody. I'm really glad to see that there are some of you up. We've got the guy JT and Scooby and Charlie and M Hunt. Let's see, miss anybody yet? Anyway, welcome, everybody. I'm really glad you're here. If you looked at, oh, before I start anything, I need to read this disclaimer and get this out of the way. Um, I don't ever want to have any issues brought up with the lifeboat. Okay, here it is. None of what I will present has been evaluated by the FDA. So the products and information that are contained herein are not intended to diagnose, treat, cure, or prevent any diseases or medical problems. This is not intended to replace your physician um, or your physician's recommendations. The information provided is for educational purposes only. Okay, guys? I hope that covers it. Okay. If you look at the thumbnail this morning, Misha did that for me. Not my cat Misha, but our Misha. I think she's on Facebook. It's under Brad and Misha. She is a tremendous artist. She does some amazing stuff, and they are going to have. What did she say? Was it Netflix or Amazon? They lost their daughter, and there's a what's the word? Sorry, guys, I'm still not feeling my best. What is the word I'm looking for? A documentary, and it's either on Netflix or Amazon. Well, will be on Netflix or Amazon. I can't remember which one she told me, but she's an amazing lady. Amazing the things that she can do. I just really wanted to start showcasing some of what she can do, and she did this thumbnail for me, which I loved. And if you guys look on Facebook, you'll see all the amazing stuff that she does. So I just wanted to give her a shout out and a big thank you for her help. I'll definitely be calling on her again. Anyway, I wanted to go over the medications that are most commonly used for addiction. And I wanted to start with sugar, because that, I think, is one of the biggest addictions anywhere. It can be bad. Excuse me, just one second. I really got to get a drink before I get started, guys. I forgot to bring it over here. Sorry about that, guys. All right. I want to start with sugar, because that really can be a problem, and especially after you have gone through opioid, or what are you doing, cat? He's biting my heels. When you are trying to give up an addiction, a lot of times you turn to sugar. It does give you that same boost, that dopamine boost, and it can be very, very addicting. I don't know if you guys are aware, but about 85% of Americans, I don't know about the other countries, but about at least 85% of all Americans have or have had a Candida albicans overgrowth in their system. In your body, you've got all kinds of friendly flora, friendly bacteria that live throughout your intestinal tract. They do a lot of different things. One of the big things that they do is they produce all your neurotransmitters down in your gut. But if there's an imbalance, say you get a sinus infection and you go to the doctor and he gives you some antibiotics, that's going to kill whatever bug is, infesting your sinuses, but it's also going to kill a lot of the friendly stuff in your system that you need. And when that happens, the candida, it's a yeast. This particular one, it's Candida albicans, not there's a crazy one going around, was it Candida auris, that people are dying from. And it's, I guess, once it gets into your medical, into a hospital or something, it is so hard to eradicate. It does not care about disinfectants. It likes cold, hard surfaces to live on. It's crazy, and it's a problem. But the one I'm talking about is Candida albicans, and it does live in your system. And when everything is balanced properly, it's not a problem. However, like I said, if you take some antibiotics, or you go like you have a colonoscopy and you got to clean your whole system out, that wipes out a lot of it. There's a lot of different things that can happen to you that will give you an imbalance in your gut. And when that happens and the candida takes over, you get an overgrowth. And this can be a real big problem because it hijacks your system. Its favorite food is sugar. And it doesn't matter if you're drinking like juice, the sucrose, that's a natural sugar. If you're drinking soda, you've got the glucose. If you're eating refined carbohydrates, like white bread, pasta, things like that, when your body breaks that down, it turns into sugar. And the candida loves the sugar. And honestly, it will hijack your system and tell you what to eat. So if you find that you are craving sugar all the time, there's a good possibility that you've got an overgrowth of candida in your system. And it can, I listened to two doctors discuss this a couple of years back, and they were talking about how this overgrowth of candida can actually cross the blood-brain barrier and get into your brain, and it'll cause a lot of inflammation in there. So you're going to get a lot of headaches, a lot of what's the word, where you're just kind of fuzzy. I can't think of the right word. Everything's a little tamped down and fuzzy, and you just can't think properly. Like, can't think of the word. Anyway, it causes a lot of problems like that, and it can cause a lot of pain as well. Not just headaches, but it can, create a lot of muscle pain. It can really be a problem. And like I said, a lot of people don't even realize that they have it, and it's a big problem now, mostly because of our diets. Especially if you're not eating whole foods, if you're eating a lot of processed stuff. Things that you make from a mix, or, something that comes out of a box or out of the freezer into the microwave, things like that, that are highly processed, and they have a lot of these things in it, that break down into sugars. Americans really have a crappy diet. It's not good. Cat keeps biting my heels. I guess he wants attention. Stop it. Anyway, there's a good way to test. Really easy, doesn't cost you anything. You can do it right at home to see if you actually have an overgrowth. If you find that you are craving sugar all the time, that's a good indication right there. But this is a really easy test. Take a glass of water, put it by your bedside at night. When you get up in the morning, go and rinse your mouth out with water, spit it out, and then go back to that glass of water and spit into the water. You don't want mucus, don't suck it in from your nose and then spit it out. You want your saliva. And within a few minutes, if you have a bad overgrowth, you're going to see what you're looking for in that glass of water is, first of all, if you spit on the surface, and you have that overgrowth, you're going to see like little legs start to trail down from that spit on the surface. It'll look like just little legs they're starting to creep down. That's an indication right there. In the center of the glass, if you find little cloudy, floaty bits, that's an indication right there. And then if your spit ends up sinking to the bottom of the glass and it's just kind of a cloudy mess at the bottom, that again, that's a positive indication that you've got an overgrowth. If you have a bad one, within 3 minutes, you're going to start to see everything in that glass. But give it up to half an hour, and if you don't see any of those things in that water, then you're probably good. But a lot of people have got their system hijacked by this candida. Is telling them what to eat. Not good. And it's a pain in the rear end to get rid of it. But it's really important. Let me read you the list of all the things that I found. There are a lot more than I realized since I looked at this last. Where did I put my notes? Gives you a lot of problems. Okay, like do your spit test, and if you see positive results from that, kind of back it up with these questions here. And if you get, I think it's 3 or more out of this list, along with that spit test, then you probably have that overgrowth. When you eat, do you bloat? Does your stomach start to distend and you're really uncomfortable? Do you get, you get gassy right after you eat? That's an indication. Do you have acid reflux? Do you get a lot of ear or sinus infections? Especially sinus infections that just don't seem to die. It could actually be the candida that is the infection. But ear, sinus problems, that's a good indication. If you have a lot of fatigue for no reason, if you just find you're absolutely exhausted, to the point of, like chronic fatigue syndrome or something, that's a good indication, because it tells you just to eat all that sugar, you get that spike in your blood sugar, and then you crash, and your body's trying to fight this overgrowth. Of course, you're going to be exhausted. Another indication is, do you have a dry mouth all the time? Another one is your vision, changes in your vision. Do you, all of a sudden, your vision's blurry, and then it'll go back clear, and then a little while later, it'll be blurry again. I know that used to happen to me a lot. I used to have a bad problem with this. Are you hypoglycemic? Do you get, if you miss a meal, do you get hangry? Do you start to shake? Do you, does your blood sugar get really low? That's a good indication. Do you get sleepy after you eat? Let's see. Do you sweat when you sleep? Getting sleepy after a meal, just a regular meal, not like Thanksgiving dinner, but just a regular meal. And if you find you're sweating when you're sleeping, those are all indications of hypoglycemia, which can be caused by this overgrowth. Another problem that it can cause is constipation or diarrhea, or both. Are you borderline anemic? Do you have rashes? Do you find you break out in rashes? Just different places on your body. Do you end up with fingernail fungus or toenail fungus frequently? That's another indication. And the nasty one, do females, do you get vaginal yeast infections often? And guys, do you get jock itch often? Again, those are indications that you most likely got an overgrowth of this candida. And this causes, that's just what this list of stuff I just read you is just different symptoms. But let me read you what this overgrowth, the problems it causes. Sexual dysfunction and impotence. It really messes up your hormones. Arthritis, autism has been linked to this. Chronic hives. My mother breaks out in hives for no reason at all the time, and I cannot convince her to try to clean her system out. Let's see. Again, we talked about fatigue, but irritability, PMS, severe PMS. Again, digestive disorders, celiac disease is actually linked to this. A short attention span is another one. Headaches, migraines, especially, memory loss, vaginitis. That could include, not just yeast infections, but bacterial infections, things like that. Um, Skin problems, hyperactivity in children. It can cause that. Again, we talked about the hypoglycemia. Let's see, menstrual problems, not being regular, things like that. It can really mess that up. Urinary disorders, even incontinence at times. Um, you can get respiratory issues, like bronchitis, upper respiratory infections. A lot of food and environmental allergies can be a result of this overgrowth, and learning difficulties in children as well. Um, let's see, wrote down so many. Let's see, chemical sensitivities in foods. Short-term memory loss, it can create that. Let's see, poor coordination. Mucus in your stool. When you go to the bathroom, do you see a lot of mucus? That's an indication right there. Do you get frequent colds, and is your nose running all the time? Again, it's the inflammation. I used to have it terribly. I'd get so much inflammation in my brain because it can cross the blood-brain barrier, like I said, and get into your brain and cause a lot of inflammation. I went to my chiropractor when I first found out that I had an overgrowth, and at the base of my skull, that foramen ovale where your spinal cord exits, your skull. My brain was so inflamed that he could feel it at that bottom trying to press out. I mean, I had that, and I had horrible headaches, things like that. It's not fun. But when you have a lot of inflammation in your brain, you're going to have a runny nose all the time. It's just that pressure, that all that inflammation, it's got to come out somewhere. And runny nose is one of those. Recurring strep infections is another one. Do you have like a white coating on your tongue or in the back of your throat? Another indication. Bad breath is one. Thyroid problems. I've had thyroid problems ever since I had that bad overgrowth. And depression definitely causes depression, all that inflammation in your brain. And also the overgrowth in your gut. You don't have those friendly bacteria producing all the neurotransmitters that you need, especially the nice ones, like the endorphins, those hormones, and dopamine, things like that. Those are produced in your gut. Tightness in your chest, mood swings, loss of balance. I was talking about, coordination. If you have a lot of ear issues, you can end up with, fluid that gets trapped in your ears, and it can really mess up your balance. You'll get vertigo and things like that. But I mean, it really causes a lot of problems. And there are other issues that this overgrowth kind of just goes hand in hand with. If you have irritable bowel syndrome, autism, again, fibromyalgia is linked to it. Cancer is linked to it. Cancer, just like the candida, they love sugar. That's their food. That's what they love. And I remember I was doing a tour of McCady Hospital up in Ogden. I used to work there, and when before I started, we did this tour, and I remember walking through oncology, and there were a bunch of ladies that were sitting in their easy chairs, and they were hooked up to their IVs, and they were getting their chemo, and they were all sitting and chatting, and they were all eating ice cream. And I thought, what are you doing? It's crazy. Nurses, they don't teach the right stuff in nursing school. Nurses should know better. You don't give cancer patients sugar. That's just supporting the cancer. Anyway, let's see, chronic fatigue syndrome. Epstein-Barr virus, pneumonia, lupus. Again, we talked about acid reflux, hiatal hernia. All of those that I just read, those just go hand in hand with candida overgrowth. Okay, what to do about it? I have when I first treated mine a couple of years back, I used, what was it? Grapefruit seed extract. I just got it at the health food store. You know, I just went in and the guy that runs it here in our town has just a wealth of knowledge. You know, I just went in and said, "Hey, I'm having this issue. What do I do?" And he, you know, showed me a bunch of different things, but I didn't know. I was just doing some reading about this last night. I didn't know it can take a year to clean your system out of this overgrowth because of the spores. This trying to kill and get rid of those spores and get them out of your body, really difficult. It can take up to a year. And I thought, oh boy, because I have many times, you know, I've treated it, it's gone away, and then like Easter or Christmas have hit, you know, when I've, you know, eaten all kinds of sugar and cookies and all these naughty things that I shouldn't eat, and it's come back, you know. And I can always tell too, because it would always make at the end of the day, my hands would get really puffy, my midsection would get really puffy, and my ankles would disappear when I ate a lot of sugar. You know, and that's how I know when I need to treat it again. But I guess you can successfully treat it so it never comes back, but it does take time. And this is what I have been using lately, and this is a Dr. Christopher's formula, intestinal sweep, and this stuff, I know it's got, let's see, black walnut hull, pau de arco bark, oregano, olive leaf, grape root, black walnut hull, let's see, and cloves. And you know, it's just all natural stuff. But this gentleman, this Dr. Christopher, he's not alive anymore, but he was a naturopathic doctor and a master with herbs, and he knew his stuff. I mean, he studied all over the world, and he has put these formulas together. So all of these different herbs, they work synergistically together. And, you know, so I didn't realize that it can take up to years. I'm just going to take this stuff and just keep taking it. But there are a lot of other products online. There was one of them, I was really impressed with this one website. Let me tell you what it was. And I will put all this stuff on the community page, all of, you know, the websites where I've taken this information, so you guys can look at it if you want to. Let's see, it was gethealthyagain.com was where I found a lot of this new information about the candida overgrowth. Let's see. Oh, I was going to tell you too, this was kind of interesting. A lot of women these days are having hormonal issues. They have enough estrogen, but progesterone is another one that women should have. If you have this overgrowth, the candida loves it. It devours your progesterone. And there's a medication called prednisone. It's an anti-inflammatory used for a lot of autoimmune diseases, things like that. And I didn't realize how they made it. I was reading about it last night. They feed a fungus progesterone, and it produces the prednisone. You know, like I was saying, you know, if you're female and you've got this overgrowth, it's going to eat all your progesterone, and you're going to have hormonal imbalances. And that's why it can create a lot of sexual dysfunction and menstrual irregularities, things like that. Also, it can give you acne, saggy breasts. It can make your hair thin. It can even make, in females, it can make their skin very thin to where they can't even stand to be touched. And I know that a lot of people with fibromyalgia are like that. They get very thin skin and they cannot stand people touching them. They can't wear tight clothing. They can't wear bras, anything that, really pushes on your skin anywhere. I know that's a problem. And I'll bet you it's because of the candida overgrowth. But anyway, that's why a lot of females get migraines and depression, again, is because of this hormonal imbalance. So anyway, let me tell you about what other things you can do. You want to have your body more alkaline. And the best and the easiest way to do that is to take about 9 tangerines a day. I know that sounds like a lot, but don't juice them. You need to eat the whole thing, but 9 tangerines or a combination of tangerines, lemons, and grapefruit. If you can eat those every day, that's going to make a nicer alkaline environment in your gut. So you can get those friendly bacteria starting to grow again. So, you also want to make, like I was saying before, you want to avoid carbohydrates, finely processed carbohydrates, sugars, things like that. You want to avoid that. Lots of fresh organic vegetables, fresh produce like that, along with all of that citrus. Let's see, I talked about the grapefruit seed extract. I showed you the intestinal sweep. I know cloves is another good one. Oregano. I know there are a lot of different oils that you can use to treat this. There's all kinds of stuff. You really need to just go online. If you do that spit test and you think you have the overgrowth, there's a lot of different things. Just look up how to treat candida overgrowth. You'll find all kinds of things. But I recommend that Dr. Christopher's products. And there were some really good ones on that website that I was just telling you about, the gethealthyagain.com. They have 3 different treatments for candida, and they said they said it's best to rotate them. Just every month take a different one and just rotate through them for a year. And that's supposed to help get that out of your system and get the spores out of your system. I had no idea it would take that long. Another thing that you can do, digestive enzymes. Lots of people are deficient in enzymes, and I use these a lot. This is just, I hate trying to get this. Okay, this one is a papaya enzyme. They're just chewable. I think you eat like 4 of them when you have a meal. I think, let's see, this one you take 3 tablets with a meal, and this one has got all kinds of different enzymes, and it's got some probiotics in it. Let me see, it's got, let's see, pancreatin, amylase, protease, bromelain, papain, that's this stuff, pepsin, ox bile. Oh, that sounds nice. Lipase and cellulase, and then it's got lactobacillus acidophilus. Actually, it's got 2 different acidophilus strains in this one. But I mean, those are just other things you can do. And there's all kinds of different products in health food stores or online as far as these enzymes and probiotics. But if you're trying to get rid of that overgrowth, you want to be replacing that overgrowth with some really good bacteria. There's all kinds of good probiotic products on the market, and yogurts are really good to live bacteria, like in kombucha, sauerkraut, things like that, have a lot of probiotics. Apple cider vinegar, the organic good stuff that you got to shake up. It's got all kinds of goodies in it. That's a good one too, to replace the bacteria that you have. Let's see, was there, I think that was everything as far as the sugar. But I have found personally too that with sugar addiction, the overgrowth doesn't help because it hijacks your body, tells you what to eat. So you're going to crave the sugars. But, um, you know, a lot of us, as addicts, it's really easy to get addicted to other things like sugar and caffeine and nicotine, things like that. Um, but I found that with the sugar issue, if I'm really craving stuff, I started to treat the candida overgrowth, and I just refuse to eat white bread and pasta and all the things I love, but I just don't eat them. And it's really hard for a couple of days, and then it starts to let up, and then you don't miss it anymore. And then when you have it again, you're kind of like, oh, that is so sweet. Or it's really heavy or something. It's kind of funny, but it does. It takes a couple of days of abstaining, but it does get easier. Um, but I tell you, it can come back because I'm pretty sure I've got a slight overgrowth right now going on. Anyway, that was sugar. The next one I want to talk about is nicotine. Oh, sorry, guys, I got notes all over the place. Let's see. Where's my notes on that? Where'd it go? Oh, it's on the floor. Okay, the nicotine addiction, that can be a big problem too. The cigarette smoke, we all know what that does to our bodies, to our lungs. Not good. There are other ways, if you need that nicotine, there are other ways to do it. But, I really do recommend quitting. Just it's, there are side effects and long-term effects in nicotine. You really don't want that, But if you want to, if you're smoking and you want to quit, there are some really good alternatives. I was looking in Walmart and the other grocery store last night at everything that they have. And they've got the gum, the lozenges, the patches. We have a vape shop here in town. They've got all kinds of different flavored nicotines, things like that. I don't know how I feel about vaping, taking those things into your lungs. I don't know. I do it personally with when I have a lot of pain with my little vape pens, my THC. But but it's not a constant thing like a lot of people where they're taking it in all the time. But but there are better alternatives than just the cigarettes. They also can deliver nicotine in a nasal spray that you just spray up your nose, or an inhaler. Those little asthma albuterol inhalers for if you end up with asthma or bronchitis or something, and you suck it in, you can deliver nicotine that way as well. But the nasal spray and the inhalers are prescription only for those two. And I was looking online. I found some really interesting stuff. There are herbal cigarettes that have no nicotine, nothing in them that's going to hurt you. And that might be a good alternative. If you are using nicotine replacement of some form, those herbal cigarettes would be a way while you're trying to quit to deal with that oral fixation, because for a lot of people it's something that you do with your hands and your mouth all the time. And that might be a good alternative. There's another product that I saw last night, and it's called Quit Go, and it is an oxygen inhaler. It looks like a cigarette, and it's got a soft tip so you can chew on it and play around with it. If you've got that oral fixation issue and it's driving you crazy, that's something that you can use along with the nicotine replacement too. And it's just oxygen, and it's actually the only thing that they will allow on the only cigarette that they'll allow on flights. Let's see there. Okay. I found there are a lot of different websites that have offer a lot of help, and there's one girl that has come up with this quitting method called CBQ. And it was really interesting. I watched part of it. Nicotine does not stay in your system very long. That's why people that smoke are, constantly having to go out and smoke again, because your liver and your kidneys break it down and clear it out of your system really quickly. I think after, what was it, 2 hours, 50% of the nicotine that you took in your body's gone, so trying to quit smoking, this girl said it's 80% mental and only 20% physical, because the nicotine, yes, it's extremely addictive, but it's also very weak. It's got a very short half-life. And she said, it takes about 5 days to honestly beat a nicotine addiction. After 5 days, it's, if you aren't smoking anymore, after 5 days, it's going to be out of your system, and you're going to be able to finally, not have the cravings anymore after 5 days, according to her system. I found that really interesting. There's also an app that I think it's a couple of veterans that came up with this, and it's called Back Off. Like I said, I'll put this in the community, on the community page, all of these websites. But Back Off Boot Camp is just an app that you can download on your phone, and they also have the dip. They have some that is very similar to Skull, some that's similar to Copenhagen, and they have, but it's mint leaves or tea leaves, but it's processed to have the same texture, and they flavor them and everything, so you're still getting that oral fixation while you're trying to quit. But I guess this app gives you a lot of support. There's also a number you can call, 1-800-QUIT-NOW, and it's got really good support. I mean, they really help you figure out, what you want to use as far as nicotine replacement and things like that. But I guess it's really, really good support. So I'm definitely going to include that one in there as well. Now, there are 2 medications that they use as well. I'm sure you've heard of them. Chantix has been around for quite a while. The generic name for that is varenicline. I can't ever say it right. Varenicline, I guess is the proper way to say it. This is a really interesting one. It was really good to use, to try to quit smoking. This one you actually want to start taking a week before you actually start to cut down on the amount you're smoking. Let's see. Sorry. Where is it? I wrote down the. Anyway, let's see. If you're taking varenicline, you do not want to drink much alcohol at all, and for us, it's not a good idea anyway. Gosh, it's been so long since I actually gave anybody this medication. I'm trying to remember how it works. If I remember correctly, it binds to the receptor sites where the nicotine usually binds to. I don't think it binds completely, but it does enough that it starts to help so that you, number one, don't enjoy smoking as much, so it's easier to cut down, and it reduces the cravings for the nicotine. So that's a really good one. What's that? It's on the floor. I had one page here where I had all kinds of stuff written down about this one. Good grief. I'm sorry, guys. Let's see. Good grief. Yeah, it's bugging me. Anyway, something that if you are already suffering from depression, and it's bad, it's probably not a good time to be taking this particular medication. It can, there have been instances where people have really gone off the rails on this medication, but they were already had a mental illness. Anyway, it says just things to think about when you're taking this. It said, with nicotine withdrawal symptoms, this is going to help with them, but but you are still going to experience some of them with, you might have an increase in your appetite. I know my neighbor next door just quit. So proud of her. She quit just a few months ago, and it was the hardest thing she'd ever done. But she replaced it with food, and oh boy, I feel bad right now. She's really struggling with the sugar thing now. But, you can only just do one thing at a time. She'll get there. I'm so proud of her for quitting smoking, because she'd been smoking since she was like 11 years old, and she's 34 now. So that's a long time to smoke. Anyway, let's see. The other things you might experience, weight gain, trouble sleeping, a slower heart rate. You're going to have that anxious, restless feeling and that urge to smoke, especially, at the beginning. Anyway, this one is a really good one to use along with the nicotine replacement, and you can also use it with the other medication that is available to treat nicotine addiction, and that one is bupropion. Wellbutrin is one of the names. It's an antidepressant, and it's unlike any other antidepressant on the market. What it does is how do I explain this one? It inhibits, in your brain, the little neurons, they send messages to, along to each other, and you've got, in between those neurons, you've got that little synapse, and that's where your neurotransmitters come in, is right in that tiny little space. And this particular medication gets in there, and instead of after you have used that, like dopamine, instead of your body reabsorbing that, it inhibits that from being taken back up. So there is more available. Does that make sense? You've got more, what were the two? Norepinephrine and dopamine. That's what it inhibits, that reuptake. So there's more available. So that's going to help. They're not exactly sure how it helps with smoking cessation, other than it just, gives you more transmitters available. You're going to be really stressed when you're, trying to get yourself off of nicotine. You're going to go through it. You might experience depression, but you're definitely going to have anxiety and just a lot of issues like that. And so if you've got, extra dopamine available in your brain, you are going to feel better. It is going to make it easier. But this one, some of the other names of it that you might recognize, aplinzin. I've never heard that one before. Zyban is another one. Again, Wellbutrin. They say this one works really well with the patches, but you can use this one. You can use the bupropion with the Chantix, the varenicline. You can use them both together. I remember what the varenicline. I remember what it did. It decreases that anxiety that you experience when you're going through the nicotine withdrawals. It helps you mitigate that. If I remember right, it affects norepinephrine, if I remember correctly. This page does not have it on there. Anyway, Those are, like I said, those are two medications that you can use along with the nicotine replacement if you want to quit. And both of these medications too, you want to take them, you want to start a week before you start to plan to, cut down on your cigarettes. And the varenicline, I think, only really works for up to 2 weeks. If I remember correctly, the bupropion, you can stay on for a couple of months. And, I would really recommend doing that, if bupropion is something that you can take. But I really like that you can use both of these you can use them together, along with the nicotine replacement. And, that's got to be very helpful. Let's see, the next medication I want to go over. I'm sure you've all heard of antabuse. Of course, this would be for alcohol abuse disorder. I can't think, guys. Anyway, this antabuse comes in an oral tablet. And it blocks an enzyme in your body that when you drink alcohol, you have different enzymes that break things down. And this one blocks the enzyme that breaks down alcohol. Excuse me. And it produces very unpleasant side effects if you drink after you have taken it. It says here you shouldn't use this particular medication. Disulfiram is the generic name for it. It says do not take it if you've had alcohol in the past 12 hours. And you do not want to take it, drink while you're taking it. And for up to 14 days after you finish taking this medicine, you still want to abstain from alcohol. And really, if you're addicted to alcohol, that's the goal anyway. But this one can be really nasty if you've taken it and then you have a drink. And even things like alcohol from cologne or alcohol in mouthwash, things like that, you can have an adverse reaction. That's something that you have to be careful with. Let's see. Like I said, if you're taking this medication, to try to help with alcohol addiction, you really want to avoid situations, where people are drinking. You don't want to be tempted. Believe me, people have done it. I've heard horror stories when I was a nurse about people's reactions. This is not fun. It says even small amounts of alcohol can produce unpleasant symptoms while this disulfiram is in your body. Okay, first of all, you're going to get flushing. You're going to have warmth, like your face, your neck. You're going to turn red, or you might feel kind of tingly. But it's not a pleasant sensation. You're going to start sweating. You're going to be thirsty. You're going to get very sick, like projectile vomiting. If you've had, if you drink a large amount, it's not fun. You can end up with chest pain and shortness of breath. Your heart is going to just start pounding. It's going to feel like it's going to pound out of your chest. You might be confused. You might be dizzy. You might be unsteady. You're weak. You're going to be lightheaded. You might feel like you're going to pass out. I mean, it's not fun. And there are some serious side effects. If you decide to try this medication, while you're trying to recover from alcohol abuse, this is a good option. But if you take this and all of a sudden you get eye pain, vision loss, you get very confused, or you have some unusual behavior, or if it looks like your liver is having issues. And the way you can tell that is, you're not going to feel well. You're not going to want to eat. You might have pain in your upper right quadrant of your abdomen where your liver is. You could get clay colored looking stool when you go to the bathroom. Your skin might turn yellow. You get jaundice in your eyes and your skin. Those are all symptoms of your liver having issues with this medication. And it can be really dangerous. So if you take that and you have any of those side effects, you gotta call your doctor right away. That's not good. Another thing that they haven't put on here as far as symptoms of your liver being overtaxed and stressed, rashes, any kind of, acne or hives, or any kind of rash, where your skin has an eruption of some kind. Those are all indications that your liver is stressed. Let's see, was there anything else on that one? This one too, if you are taking this one, of course it's prescription, but you want to tell your doctor everything that you are taking, including supplements and herbs and things like that. There are some potential drug interactions, and so you really, need to really sit down with your doctor and talk about this one. Tell them everything that you use, because you don't want to end up in the ER just because you're trying to, deal with your alcohol dependency. Another one, lofexidine. Let's see. Oh, what that one? Hang on, that one. That's not. I don't want that one yet. That one's for opioid. Okay. I really like this one. I'm sure you guys have heard of naltrexone. It's Naltrexone, naltrexone. Another name for it is Vivitrol. This one is, you can use it for both the alcohol use disorder and the opioid use disorder. It comes either in, let's see, I think this one, let's see. Okay, it is available in a pill form for alcohol use disorder. But it's also, there's an extended release injection that you can get for alcohol or opioid dependency. Let's see, the pill is something you can take every day, but the injection, it's an extended release, and I think it's once a month for this one. Anyway, I really like this one. This naltrexone, it blocks the euphoric and sedative effects of opioids. So anything like heroin, codeine, morphine, fent. This drug, this naltrexone, binds to the opioid receptors. So it suppresses the opioid cravings that you're having, and it also, because it's bound to those, other opioids can't bind. But like I said, this one is for alcohol or opioid use disorder. Let's see. The way that with the alcohol cravings, it reduces those because it binds to the endorphin receptors in the body, and it blocks the effects that you get from alcohol. So it's not pleasant. But this is something that you have to be monitored on. You need to have some good support system set up and everything before you before you're using this one, but I think this is a really good option. I really like this particular medication. Another one, everybody knows about Narcan. This one, I just wanted to show you, this is where I live, you still have to get a prescription to get this, but these are the little nasal sprays that you just, you get it up in your nose. Well, you're going to have to, if you're administering this to somebody, it's because they're probably out because of an opioid or opiate overdose, and this hopefully will bring them around. This, it binds to those opioid receptors, and it stops all the effects of opioids immediately. So, if you bring somebody around, on this stuff, if they've taken a lot of fent, even 2 of these is not going to be enough. But, if you give this to somebody and it brings them around, they're instantly sick. They're instantly dope sick. It's not pleasant, and people do not like it when you bring them around on this. They get very violent at times, and they don't want to go to the hospital. They don't want to be sick. They just want to go get their fix again so they don't get sick. This isn't, I wish we didn't have to need this so desperately, and we sure do, but they include this along with the, I can never say it, buprenorphine, like the Suboxone, the Subutex, things like that. They include it with the buprenorphine, so that you can't inject the buprenorphine or snort it, or they do that just so you can't get really high off of it, because this is something that hopefully is going to help you get over your addiction with opiates. Anyway, that kind of just puts me right over into the buprenorphine. This comes in a lot of different forms. They have sublingual tablets, and that's how when I was a nurse in psych unit, that's how I used to give it to patients, was they just put it under their tongue. But I have actually tried the Suboxone, the little film, these little film strip things that you stick inside in your cheek or under your tongue, and it's absorbed that way. Let's see. There's even an implant that you can have. It's called Probufin. I wasn't aware of that one. And then they also have an extended release injection of buprenorphine. I was reading about this because this is something I've never given to anybody, but you might have heard of Sublocade. That's what this is. It's a long-acting injection. You get it once a month, and you have to go to somebody who's had the training and is certified to be able to give this. But it lasts a month, and when you first inject with it, you'll see a jump in the serum levels of this drug in your blood, but then very soon it just levels out, and you've just got a constant amount of this drug in your system for a month, which is really nice. It prevents you from going through those withdrawals, and those are horrible. They're just horrible. But this stuff, let's see. I mean, this works. It's an opioid partial agonist. The effects are a little weaker than full opioid agonists, like methadone and heroin. Those are both full opioid agonists. But this one, it can produce a euphoria and depress your respiratory rate. If you've never, if you're not addicted to opiates, it can be a problem. But this one, it keeps you from all of those horrible withdrawal symptoms. That's not fun. Um, Not fun at all. I was reading about this. They actually use the long acting, the Sublocade, for chronic pain. So I'm actually going to. I found there's a doctor about 75 miles away from me that can do these injections. I'm seriously going to go meet with him and see if this is something, because not only would it make sure that I never have the cravings for opioids again, but if it could treat my chronic pain too, that'd be fabulous. So it's definitely something that I'm going to look into. But like I said, the buprenorphine, they put the naloxone with it so that you can't crush it and snort it or inject it, anything like that. That's why they put that in there. The other one that I want to go over is methadone. I'm sure everybody's heard of methadone. This is a really long-acting, it's a full opioid agonist. I think that's the first one that they used, if I remember correctly. The first medication they used to treat opioid addiction. I know this one is really good for pain management as well, but it is very long acting. This one, it just reduces the opioid cravings. It blunts all those withdrawal symptoms that you get. It's something I know here where I live. There's one office where you can go and get the methadone, but it's something you have to do every day. And I don't think I don't think there are many that use this option anymore. But it's still a viable option. Anything that's going to help you get off of opiates or opioids, whatever you're taking, and prevent you from getting dope sick. That's wonderful. And this stuff is so long acting. With the buprenorphine, that's something you take twice a day. Methadone, I think, is what it's been a long time since I gave a patient methadone. I think it's once a day, if I remember correctly. I do know it's a long acting one, but it's a good one as well. There are some really good options for addiction. A lot of it though is, that you've got all these little things that can help, but it's really important to, if it's at all possible, to have a support group, which we have here. But support groups are really important. Seeing a psychiatrist and a psychologist for therapy, very good ideas. You want to find out why you have been, filling your body with alcohol or drugs of some kind. You want to get to the bottom of it. And it's not wise to go cold turkey on anything. You could be very, very ill and end up with some very life-threatening problems. So, especially with alcohol, but there are a lot of options out there. To my knowledge, there isn't anything right now to treat amphetamine abuse. I don't think there's anything for that one, but there are a lot of helps for the others. And, if you're struggling, there's no reason to suffer with all those withdrawal symptoms. Going cold turkey and white knuckling, it's not fun. And people that do that tend to relapse a lot more often. At least that's what I've seen as a nurse. Anyway, I think that was all of them that I wanted to go through. If I come across any more, I'll definitely let you guys know about them. But I will put some of this information on the community page for everybody. Cultivate, yeah, there's nothing that I know of for amphetamine abuse right now. I know that sucks. Because that's a tough one because, those amphetamines just release ungodly amounts of dopamine in your brain. It's scary. It's very difficult trying to get off of that. Not fun. Hopefully, you would think, with all the things that they can do and all of the different medications, you'd think they'd come up with something by now. But let's see. Just wanted to see if there were any questions. Photographers here. JT, Dennis Brace. Let's see. Cultivate kindness. I'm not seeing any questions. But anyway, if you guys have questions about this, I know I kind of ran through these quickly because I saw what time it was. If you have any questions, get on Facebook, and post them, and I'll gladly, if I don't know, I know where to look to find out. Something else I was going to tell you guys, but I sure can't think of what it was right now. But thank you, everybody. Oh, and Dazzlebug's here. Cool. Thank you for getting up early and joining us. I know I'm not Tommy, and I know a lot of people, when they see it's me, they turn it off. I don't care. That's fine. But, I do have a lot of experience in this area, and, I can always answer questions. And yeah, anyway, thank you for getting up early and for joining us here. The lifeboat is unlike anything else I have ever experienced, and the people here are amazing. The caliber of people that are here are amazing. People that have gone through addiction, and even those that are in active addiction. I mean, we all know what it's like to hurt and to suffer and to want to hide from all of that and to numb it all out. We know what it's like to hurt. And because of that, former addicts are some of the kindest, most understanding, most giving people I've ever met. Like I said, the caliber of people that I meet here, it's amazing. You guys are amazing. It's you guys that makes this work, so thank you for getting up early and joining us here. And Tommy will be live at 5 this afternoon, and I will see you guys all then. You guys have a good day, okay? And again, thank you guys for coming.